Now, in this world, there is nothing sweet past this thing which you do for her mind. But come, just take a let me tell you something. Never put anything inside that ear. Say it after me. Okay. So Aproko does drew our attention to the fact that this thing is not meant to be put inside the ear.
Go to the back of the cotton buds that you use. Read it. It's there. Do not insert into your ear canal.
Wait, what?
So all of us have been using it wrong. We have been abusing it. The ear is essential for balance and for hearing, and we have to take care of it in order to maintain these functions. And there are 3 parts of the ear that you need to know. We have the outer ear, the middle ear, and the inner ear. So the only part of the ear that should be cleaned with whatever it is that you're using that is safe is the outer ear. And that is what the cotton bud is used for, and not for the middle ear or the inner ear. Itching is one of the major reasons why most of us insert that big pen cover, that cotton bud inside our ear. And some of the things are even very, very unbelievable, but that's not the point. Now, the ear is self-cleansing. That means it cleanses itself by itself. So it needs not our own effort to bring things out, but sometimes wax can build up and you may need it to be taken out in a way. But calm down. First of all, what is that thing that you bring out when you clean your ear and you feel like, this is the reason why it is itching me? Now, earwax, also called the cerumen, is a substance that is produced by the ear to protect the ear. Now, what's the constituent of this wax? The cerumen consists of shed skin cells that mixes with sweat, sebum, and other substances produced by the body, and is essential for the protection of the ear. That is the earwax, and it's actually protective because it prevents the yamayama from entering inside your ear to cause infection. Now, imagine that you're trying to prevent yamayama by causing more yamayama. Okay, come on, understand what I'm trying to say. In an attempt to clean that ear, you don't even know the reason why you're having the itch in the first place. This is what happens.
Can make things worse. Even if swabbing removes a little earwax, it may push more back in.
So it is counterintuitive because you are ending up pushing that particular yamayama inside the ear, and then this is how the eardrum is. So by the time everything starts accumulating, it is now blocking the passage for that sound you need to hear. You're having impacted earwax. It has jammed the eardrum, and you cannot hear clearly with that kind of ear. So that is why doing that is very dangerous. And imagine that you inadvertently, puncture yourself. So now you've punctured the eardrum. You have caused wahala for yourself because you're going to have hearing issues. Yes. And you're going to have injuries, you're going to have infections inside the inner ear. So that is why using all these things is very, very harmful. Now you ask, what should we now do if you're having itching? Number 1 rule, do not give in to the temptation of putting something inside your ear. That's the number 1 thing that you should know. Because with time, with infection, the ear even becomes more itchy due to inflammation and irritation, pain and others. So it is like they're just adding insult to injury. Using things to clean your ear or inserting things into your ear makes things worse because it can lead to wax impaction, which is when the wax is accumulating. Because of the texture, it becomes adhered to your eardrum, and then it reduces your ability to hear. You have more itching and then some ringing sensation in your ear, and in the worst scenario, you can even develop hearing loss. What should you do instead if your ear is itching? You can be dancing, something like this. Okay. Now, number 1, you can just press on this small thing here. That's called the traverse. So just in a circular motion, compress it, and then you may have some relief. If it doesn't work, you can use a clean damp cloth, that is cloth that has been soaked in water, and just clean the area around your ear. That's the outer ear and not inside your ear. So by extension, you can also use warm compressing. That is using warm damp cloth to just compress around your ear. It soothes the itching and it can give you some relief. So the most important thing here is to actually know what the cause of the itching is in the first place, because if it is due to something like an allergy, you cannot say you are trying to remove something and that is what is going to cure the itching. So possible causes of this itching include dryness. The ear doesn't want to be dry, neither does it want to be too wet for a long time. For ear dryness, a few drops of warm olive oil and not hot one would help. For wax build up, over-the-counter ear drops can be used because it softens the wax and allows the wax to naturally come out of the ear. But if you have any ear conditions or you have teeth in your ear, please consult the doctor before using any ear drop inside your ear. For allergies, over-the-counter antihistamines can also help to prevent the itching. Sometimes it is due to skin conditions which should be diagnosed by a doctor and treated accordingly. Also, wetness in the ear, that is water in the ear, can also contribute, especially in swimmers and people maybe after washing the hair or something and without cleaning the ear properly. Water in the ear can promote the growth of bacteria and fungi, and then it can lead to fungal infections, bacterial infections of the ear that can lead to more pain, itching, and the bad yama things. So after swimming, washing your hair or whatever that makes your ear wet, try to use a clean towel to just keep it dry. And the funny thing that you don't even know is that this earwax that is impacted can trap in more water, and with more water, infection continues to go. So it's a vicious cycle. Irritants can also lead to itching of the ear. So shampoos, hair products, and the likes. Then earrings can also lead to itching. So you identify those triggers and you avoid them. So if this ear can't persist, it can't be like saying no one go, and then you are having a lot of symptoms, discomfort, pain, and all that, or even reduction in your hearing, please consult a doctor, a healthcare professional to help you. And don't forget to never insert anything smaller than your elbow into your ear.